For this video on suicide, it's not going to be real long because we've already kind of talked about suicide throughout the year. And so this should just kind of be a review with new information related to the intervention. So make sure that you read through your book and understand the content in your book as well as you study. So suicide, it is the intentional act of killing oneself. And suicidal thoughts are common with people that have mood disorders, especially that of depression, as we have already learned about. Risk factor myths, make sure you read over those myths. For the assessment, if a patient have had a previous suicide attempt, well, that increases their risk for future suicide attempts as well. Many people that have depression, that have suicidal thoughts, they lack the energy to actually carry out those plans. But the interesting part is April is the month of the year that most suicides occur. For that reason, they think it's because of the increased sunlight that the spring brings, and that kind of just gives your body just a little bit of energy, and they think that is why most suicides are committed in April. So just keep that in the back of your mind as you have during your practice as well. Let's see. Many people that have suicidal thoughts, they will send either direct or indirect signals. Make sure that we never ignore any hints of any suicidal. We need to assess their lethality of the plan and make sure that you're acting or asking direct questions. And no matter how uncomfortable you are with asking the direct questions, just remember that another person's life is at potential risk, so we need to not be selfish and just make us feel good, but we need to make sure that we are asking those direct questions. And the questions to ask that we've already kind of talked about is, are you thinking of killing yourself? Do you have a plan? How do you plan to kill yourself? How will you carry out the plan, and when, where, and what time of day, as well, if they know the specifics of that and are willing to tell you. So hard, soft methods, this kind of gives you an idea of the just the lethality of it. So the hard methods are those that are pretty much going to cause death. So a gun, jumping off a high place, hanging, staging a car crash. And the softer methods are those that ingesting pills, slashing the wrist, that may not necessarily actually cause death, but it very well could as well. We also need to assess their ability to the means. So if they say they're going to shoot themselves, do they have a gun? If they say that they are going to, get in a car wreck, well, do they have a car? And we need to make sure we try to keep those means away from them so they can't do that. Verbal cues, make sure that you know that, and then the nonverbal cues as well. All right, so nursing responsibilities. So if you have a patient who is inpatient and they are on one-to-one observation, it's important that the nurse maintains an arm length at all times. So that means that you are watching them when they're on one-to-one, or it may not be the nurse, it could possibly be an aide, but if the aide's doing it, we need to make sure that they know this as well. But if you are responsible for the one-on-one observation, you need to maintain an arm length to the patient at all times. You need to make sure that the meal trays, they don't have any glass or metal, silverware mainly comes in with plastic. They are being recorded, monitored. It's being documented every 15 to 30 minutes, just depending on your policies, protocol, where you work, their protocol. You want to be able to see their hands at all times. You don't want them under the bed covers. You want to be able to see what they're doing. Make sure that they swallow each dose of medication. You're always going to look into their mouth and make sure that they're not keeping any in the side to where they can take out and then eventually compile a whole bunch and take all at once. So here's just some more. The plastic utensil, they don't need a private room. The door needs to be open at all times. Make sure that the bathrooms and the shower rooms, they have breakaway rods, so if they did try to hang themselves, that would break down there. It would be unsuccessful. If there's any electrical cords, make sure that they're not long enough to where they can tie them in a knot. Unbreakable glass in the windows. If a patient has any gifts brought into them, so if they have flowers in a vase, of course the vase can't be in the room because of the potential with the glass. Go through their personal belongings and remove all of the harmful objects that they may have, and if they go out on pass and they come back, make sure that you do check that again as well. No suicide contract. This is not legally binding, but it could be helpful for some patients. What it really does is it just develops and maintains a trust between the nurse and the patient. Medications, remember we're just treating the depression, anxiety, so SSRIs for depression, analytics for your anxiety. ECT, remember that's for those that are severely depressed that do not respond to medications. Self-help groups, there are lots of self-help groups that are available that we just may need to get the patient in touch with as well. So if you have a patient that's at risk for suicide, they have self-help groups, but also if the family has to deal with someone that has committed suicide, there is self-help for them as well. So we just kind of need to be aware of those, and then we might have to get them set up with the group. Make sure you read over those keys to remember as well.